According to the Center for American Progress, the federal One Big Beautiful Bill Act slashed national Medicaid spending by nearly $1 trillion, dealing a severe blow to Virginia's healthcare infrastructure. The impact on the Commonwealth is far-reaching and localized, severely threatening care access, hospital finance, and the broader state of the economy. What does this mean for your healthcare, for your community, and for the Commonwealth? It's Stay the Water. I'm your host, Eric Claville, and you're joining us for our show as we analyze the impact of Medicaid cuts on Virginia. Once again, I want to thank you for joining us, as you always do, as we broadcast from the campus of the Norfolk State University, home of the Spartan Nation, from none other than WNSB Hot 91, the soul of VA. Well, once again, it is the summertime, and we hope that you are enjoying your family and also taking a little break here and there. You know, as the saying goes, health is wealth. And that couldn't be any truer as you get older. For every sunrise and sunset, all of us get one day more mature. But that means that we have to take care of ourselves, and also we have to ensure that our representatives in our government are taking care of our healthcare systems so that when we need them, we can definitely use them. But we found last year that the One Big Beautiful Bill that started last year, that was passed this year, will have an indelible negative impact on the ability to deliver healthcare services to you, to me, and most importantly, to the most vulnerable, those who can't afford it themselves. You know, I want to give us a little, again, as I mentioned earlier, just a little history on what took place. We have $1 trillion that was cut nationally from Medicaid. Now, Medicaid expansion was implemented during the Affordable Health Care Act, also known as the popular name, Obamacare, in order to provide states with funding that they can provide insurance to those who couldn't afford it. So you get on the market, and guess what? If you are in a certain income bracket, you can get health care, right? I mean, you can get health insurance, and hospitals accepted it, and you got health care. So you had health care access. Well, report after report showed that this was a success. You had more people insured, more people going to healthcare facilities, and more people getting actually the health care that they need. A healthier society equals a more productive society and a longer life and productive life for citizens. It's really just that simple. And many reports actually showed that. However, just as I mentioned on last year and past this year, the One Big Beautiful Bill cut funding so that individuals who had that access, had those resources from their states, don't have them anymore. So that's across the entire country. But what does this mean here for the Commonwealth of Virginia? Now, for those of you that had Obamacare or the Affordable Care Act and you went into the marketplace, I mean, think about it. You were able to access health, vision, dental. I mean, you had something that you really didn't have before, and something that you should have had. You know, I was at a very, very wonderful and one of the most uplifting and emotional bill signing ceremonies that I've ever been to. And it was a bill signing that happened in the great city of Newport News, where the governor signed a bill in the name of our former delegate here, Delegate Candy Money King, who is now the Secretary of the Commonwealth. So now Secretary Candy Money King, her daughter, Queen Candace King, who unfortunately passed away at the age of 15 from sickle cell complications. And that bill that was signed in her name provided training and access to school nurses so that they could recognize certain aspects of this disease upon individuals. But not only that, but there were always also another series of bills that were sponsored by not just by Delegate Cliff Hayes, who is also an alum here at NSU, Senator Mamie Locke and others, and Breonna Sewell, who sponsored several bills, both in the House and the Senate side, in order to provide access and better healthcare outcomes. And with that, you know, that really helped that bill is going to help a lot of people. But, you know, it's something to have a bill that will give that training. But the access to healthcare is something that individuals who don't have it, they actually need it. And with that, that's what the Affordable Care Act did. It provided that access. But however, unfortunately, what we're finding is when you remove those funds, you're going to remove that access. According to, I want to take a look at some areas in which these cuts are going to impact us across the board. Now, according to VPM, there were several areas when we were going to find where the impact of this cut is going to really make a major deficit in the health of our citizens. So according to VPM and other reports, an estimated 260,000 to 300 Virginians are currently at risk of losing their Medicaid coverage due to stricter eligibility rules and also work requirements. Now, when you take a look at what is really taking place here, you're finding where it used to be that you didn't have to, the rules were less strict, which means that you could apply for and receive these services. You could see access to healthcare. However, due to now what we're finding, these stricter rules, it is going to restrict a lot of individuals from receiving this type of healthcare in which they really need. Now, when you look at this, VPM, it says that they actually quoted several individuals in here in this particular article, but healthcare advocates more specifically in Virginia warned that the cuts could reduce access to medical care across the Commonwealth and could put half a dozen hospitals at risk of closure. And we're going to delve into a report in just a moment, a state report, which shows which hospitals are at risk of closing or going to close or at risk of closing. Notice I said that are going to close or at risk of closing, right? So once again, when you talk about the impact, this is not a good thing across the board to take away something that individuals had that really was helping them. Also, when we take a look at the impact, we take a look at hospital closures and reduced services. Now, according to, again, VPM, state health systems, they're going to face, get this number, roughly $26 billion in federal payment losses over 14 years. All right, that's $26 billion. That's almost $2 billion per year. And of course, with inflation and the rising costs of healthcare, that number is going to get up there because you're looking at, it's just going to get up there. So you're looking at, again, like I said, $26 billion loss over the next 14 years. Now, reports also highlight that 10 hospitals are at risk of closing facilities. All right, here's one. Bon Secours in Southern Virginia, Regional Medical Center in Emporia, Buchanan General Hospital in Grundy, and Carolyn Tazewell Community Hospital in Tazewell. Now, we've heard a lot about Tazewell because that's where the district was, where the judge actually basically stopped the rule that the voting or the redistricting itself was unconstitutional or they didn't follow procedures and so forth. So we heard a lot about Tazewell. Well, here's something else about Tazewell. They're going to lose a hospital that's there. Not a clinic, but they're going to lose a hospital. That tells you what type of area that we have in that particular region of our Commonwealth. But they face the highest risk, while others may be forced to drop vital services, such as labor and delivery in Farmville. Now, let's stop right there. If it's one thing that we are always doing, ever doing, we are procreating. And you need a labor and delivery section of your care facility in every corner of the world, okay? Labor and delivery to, again, provide birthing of the next generation. Now, we know that many studies, many reports, especially about women and black women as well, for the most part, are higher at risk when you look at maternal health of negative outcomes and the children that are born to them. When you think about that and you think about Farmville and that area that may drop the vital services of labor and delivery, that only increases the possibility of some type of negative outcome when you're looking at the birthing rate and you're looking at the mortality rate and the morbidity rate and the negative outcome healthcare rates for maternal health care of African American women. So again, hospital closures, risk of losing your coverage. That's what we're facing in this next fiscal year. And then also, according to the Center for American Progress, we also VPM, we also find where the sudden influx of newly uninsured patients will also increase uncompensated emergency care costs for hospitals. Now, what's going to happen there? Well, let's look at this first. Healthcare policy analysts project that these Medicaid and related SNAP cuts could cost Virginia over 26,000 jobs and strip the state and local budgets of $283 million in tax revenue. So let's unpack that, because we got three issues within that third area category when we start to analyze the impact of these cuts. The first I want to just pick back up on is that when you look at uninsured patients coming to the emergency room, well, first of all, when you come to the emergency room, you have to be treated. They're not going to turn you away, okay? That's one thing that hospitals cannot do. The question becomes, who's going to pay that cost? So 300,000 people will lose coverage, 260,000, 300,000. You're going to lose Medicare coverage. It's going to happen. It's just dollars and cents. Numbers don't lie. When you lose, again, when you cut $1 trillion of monies for citizens to get health care and you take that away, well, guess what? Somebody's going to lose health care because they can't afford it anyway, especially with rising costs, gasoline, fuel, goods and services, goods to get to you, services cost because you got to pay your workers. I mean, it's a snowball effect and a negative snowball effect of that. Increased costs, negative snowball effect. So when those citizens lose their coverage, guess what happens? They're still going to get sick. They're still going to have medical emergencies. It's still going to happen. So therefore, what ends up happening is that you go to the emergency room. Now, of course, they can't go to a PCP, primary care physician, because they don't have one, because they don't have health insurance. So they go to the emergency room, and they go to the emergency room and get help. Now, usually, they're not going until it's dire because they don't have health insurance. So they're not going to go the dire state of their health. Now, they're going to go, and then they're going to be treated. They're going to get that bill. They're not going to be able to pay it. They can't pay it. So now there's a negative on their credit report. They're getting hounded by bill collectors, collections. This bill, this is a call to collect a debt type situations. And it's not good. It is not good. And you listen to this show. You've listened to this show for over half a decade. And we give it to you straight. We analyze it. We give you the reports, not what's reported in the news per se, but we look at the studies. We look at the numbers crunching. We look at individuals who are just running the data, and we break it down to you. So I'm keeping it straight with you, is that this is not going to be good, and these are the numbers and what's projected. So they get there, they're treated, they get the bill, they can't pay it, they go to collections, negative on them, credit shot. So that also just causes a snowball effect of not being able to rent a place in a desirable location. You need to get a good job, get a good insurance rate for car insurance. I mean, everything. Your credit report affects everything. But who's going to pay that bill now? Well, guess what? That bill gets spread over those individuals who have health insurance. That's right, the middle class, the working poor, the working middle class. We pay a higher rate to cover the costs that the hospitals lose money on because they had to treat someone that was uninsured who used to have insurance until the big beautiful bill cut out $1 trillion. That's simply how it works. It's a domino effect. And when we talk about a domino effect, we're also looking at the health policy. When you look at the health policy and what they projected with Medicaid cuts and SNAP, keep in mind, $1.3 trillion was cut to give tax cuts to the wealthy. All right? $300 billion. See, we're dealing in trillions of dollars. I get lost, right? So of that $1.3 trillion, $300 billion was actually cut from SNAP, Supplemental Nutrition Food Program, right? Supplemental nutrition, all right? Used to be food stamps. The cheapest thing that we can actually manufacture We grow food. God gave us everything we need to grow food. The seed, the soil, the sunlight, the water. Put it in there. It grows on its own. It's just that simple. And it grows quick. However, the Republicans have always wanted to cut SNAP. This is nothing new. I remember teaching on this and reporting on it back in the mid-20 teens. I want to say around 2016, 2015, they wanted to cut it then. So again, this is nothing new. But they finally got a chance to cut it. And now, with the cost of food and so forth, you don't have health care. Food goes up. Well, guess what? You're going to get sicker because you can't buy healthy food. And then look what happens. Virginia, because of those cuts, could cost us over 26,000 jobs. Now, let's look at the jobs first, and then we'll go to the tax revenue. So now we lose jobs because guess what? Individuals who used to have health insurance could actually go get services, and the federal government reimburse that cost. We are able to offer that particular policy to them. They work. They actually do their job in the hospital industry. And then supplemental nutrition program. They actually do the job of distributing foods and so forth. But guess what? When you don't have that money, there's nothing to distribute at that level, so you cut jobs. There's no hospitals that you need in that area because they're cut. We don't have the money to run them. So those doctors, those healthcare professionals, those nurses, those support staff and support medical technicians that support all of that, even the persons you come in contact with at the hospital when you first check in, they're gone. There's absolutely nothing they need, nothing they could do because the money's not there. So 26,000 jobs gone. And now the tax revenue of that. Well, guess what? You get a paycheck, and guess what happens? You pay federal taxes, and yes, you pay state and local sales tax as well. Well, if you're not working, if you don't have the money to pay you, you don't get a check, you move out of the Commonwealth, guess what? There's no tax revenue that's coming there. So now our budget shrinks, our reserves shrink by 283 projected million, which is going to go up because, again, as we mentioned, cost, inflation, the whole nine, it's a snowball. So let's just say $300 million is going to go up deficit-wise that we don't have. So we lose population, localities lose sales tax, we lose revenue, state revenue, and then from there, through taxes, payroll taxes. And then from there, the economic strain snowballs and continue to snowball and continue to snowball. And we have a less healthy society. And we are now shouldering the cost more so as citizens in the working middle class or the working poor. And from there, we have to, at the end of the day, make it all work, right? So that's where we find ourselves right now. We find ourselves at a point where, that's right, we are in a crisis mode. But when we talk about crisis, I was just reading to you Center for American Progress report, Virginia Public Media. Some may say that they're biased, but they're just looking at the numbers. Once again, I'm giving you reports and sources that are simply looking at the numbers. Well, let's go to Virginia Business. Virginia Business Report article, again, talks about, entitled, Virginia Health Systems Face $26 billion in federal cuts. Again, it highlights the One Big Beautiful Bill, which the president touts in his Republican administration. However, they take a deep dive into the several Virginia hospitals that have opened or expanded despite the federal cuts to Medicaid, but they also are going to be hurting. Now, according to Virginia Business, we find where last July they mentioned, and we're talking 2025. This is a 2026 article, March, and we're looking at 2025. Virginia's Department of Medical Assistance Services estimated that healthcare facilities in the state will likely lose $26 billion in federal payments over the next 14 years because of the bill. Now, then Governor Glenn Youngkin later dismissed that number, stating it wasn't part of an official analysis, but health system officials are still voicing concerns. All right. So, once again, the numbers are there. But our former governor said, I don't think so. Right? It's not part of an official analysis. It's just kind of what these businesses are projecting that they could lose, because they don't have board members or investors or shareholders that they're answerable to. They could just make up stuff, right? No. They're projecting a very, very real scenario that will impact them. So when we take a look at what's happening, go a little bit further into this, what isn't in dispute, again, this is Virginia Business Report, all right? What they state is what isn't in dispute, even though the former governor disputed it, even though the president and the Republican Congress touted this as being a good thing. By September 2025 last year, Virginia had its first big, beautiful bill casualties. In other words, medical groups who are part investors invest in medical groups, okay? Investors. So they're looking at the numbers. They're not worried about the politics. Here's what happened. Augusta Medical Group, part of Augusta Health, announced plans to close an urgent care clinic and 2 primary care clinics in Augusta and Rockbridge County, specifically citing, guess what? The federal law is the cause, what our former governor actually dismissed. Medicaid cuts could shut down more than doctors' offices. Now, this is doctors' offices. Last June, 4 Democratic U.S. senators warned in a letter to the president, Republican congressional leaders, that 338 rural hospitals, including 6 in Virginia, would be at risk of closing if they passed that bill. Well, of course, they passed it. So let's take a look at what is happening now. So when we take a look at our healthcare system, now Riverside Smith Hospital opened January 6th, providing residents of Alawite County and surrounding communities access to 24/7 full-time emergency services in their department. Hospital with new medical office opened last September, cost $300 million. All right. So this is as Virginia healthcare executives weigh the impact of the federal cuts. They've also taken time to celebrate openings and new construction. So we're not just telling you about the bad news, but there's good news here as well. Keep that in mind. In January of this year, Stewart Community Hospital in Patrick County reopened after closing in 2017. Brandon Health, which reopened several shuttered rural hospitals in the Southeast, invested about $15 million to renovate the facility. Meanwhile, in June 2025, Carolyn Clinic opened a $500 million Crystal Spring Tower at Carolyn Roanoke Memorial Hospital, 12-story, 500,000 square foot facility, expanded emergency room. Suffolk, Bon Secours opened $85 million, 100,000 square foot Harborview Medical Center, new medical center, 18 private inpatient rooms, 4 operating rooms. So those are some projects and expansions that are in the works. In addition to that, we got other projects. $370 million expansion of Bon Secours, St. Mary's Hospital in Henrico, Central Lynchburg General Hospital. They held a groundbreaking, part of a Central Health $600 million in capital investment. Other expansions, VCU Health, proposed hospital tower downtown Richmond. You also look at Carolyn Clinic. They announced in October it would raise more than $105.6 million in fundraising campaign for the Carolyn Todman Cancer Center in Roanoke. Construction on that, in that health system, it's a 260,000 square foot center. It should be completed in 2028. It's working to raise $50 million to bring proton therapy to that center as well. So, and this is a quote from their CEO. He said the healthcare system fundraising success demonstrates our community's shared commitment to ensuring the most advanced care is available right here. So that's Carolyn Clinic's president and CEO Steve Arner. He made that in a statement. So there is good news there. However, there's a lot of construction, a lot of projections, a lot of openings. And notice that's private investment. They mentioned fundraising. However, the back end of that is you need patients for those areas. Patients have insurance. So here's what happens. If you don't have insurance, hospitals don't operate because they don't have the reimbursement that they need. So according to Virginia Mercury, a new report by Virginia's Joint Commission on Healthcare found that 13 of Virginia's 36 rural hospitals are at distant or immediate risk of closure. All right. This as state lawmakers and their constituents work to close healthcare access gaps in the Commonwealth's far-flung regions. So we mentioned a couple of regions that are far-flung, but there's a lot of growth in those regions. That's the difference. There's a lot of growth in those regions that we read from Virginia Business. However, these areas, they're far-flung, meaning they're out there, they're rural, there are the ones that are at risk of closing. This is according to the Virginia Joint Commission. This is Republicans and Democrats. They just want to know the numbers. So the commission based its analysis on patients' socioeconomic demographics insurance types, as well as the hospital's financial information to determine the risk for closure. So, King William resident, Celeste Garrett go-to facility is VCU Health in Tappahannock Hospital. It's on the list. It takes her 20 minutes to get there, she said. She worries about an emergency that if it were to close, that would make VCU's Richmond location her closest one, an hour or more away depending on traffic. According to a Franklin County resident, minutes matter, seconds matter. After brain aneurysm in 2021, this person was taken 15 minutes to her nearest hospital and then airlifted to another one in Roanoke, which otherwise would have been an hour commute. So, with that, you got rural hospitals already that are shoring up access, according to Virginia Mercury. In Southside Virginia, the women expressed concern about themselves and neighbors. Some hospitals' struggles can be traced back and include demographics and economic regional shifts. However, current strains are attributed to recent Medicare/Medicaid reimbursement rate cuts, the reconciliation bill by Congress passed last summer, which again is a big, beautiful bill that makes thousands of Virginians vulnerable after losing health insurance, and Congress's failure to renew expired Affordable Care Act credits. That's another thing. Even Republicans were pushing for just renew the credits, right? But it failed. So 33,000 Virginians have already lost that insurance. That's where we are. They're uninsured. So pending state's budget, according to this article, the state's pending budget has proposals to help the state comply with additional requirements for Medicaid and Supplemental Nutrition Assistance Program, SNAP. However, these efforts cannot fully heal what the federal actions have created, but are a reflection of bipartisan assistance. I want to give you in the last closing minutes where these hospitals are. When we look at Ballard Health Dickinson Community Hospital, also the Ballard Health System Community Hospital, all at risk of closing. Bon Secours Rappahannock General Hospital, at risk of closing. Bon Secours Southampton Memorial Hospital, immediate risk of closing. Carolyn Giles Community Hospital, immediate. Carolyn Tazewell Community Hospital, immediate risk of closing. Centera Halifax Regional Hospital, and also VCU Health Tappahannock Hospital, immediate risk of closing. With VCU Health Community Memorial Hospital, also HCA Lewis Gale Hospital, along with Duke Life Point Twin County, and also Bon Secours Southern Virginia Medical Center. They are at risk of closing, not immediate. But one thing that this shows, and that's according to the June 2026 Virginia Joint Commission on Health Care in their presentation. Health is not an option. Health is wealth, and good health care should be a right. Make sure you engage your representatives on the state and congressional and federal level to let them know that health care is needed and funding should come back to help not just these hospitals, but help you and your community. As always, we want to thank you for joining us for this show, State of Water. Before we leave, I would like to dedicate this show to DeJuan Stegall, who is the former chief of staff for Delegate Alex Askew, who died of cancer due to a disease that links black men who have sickle cell trait, and also Queen Candace King, who died very young at 15. Their names, and DeJuan was 28. Though they may be gone, their spirits and their name and their fight will live on. We love you both. And as always, God bless, and we'll see you next time.
Hi, I'm Carrie Washington, and you're listening to State of the Water with award-winning host Dr. Eric Claville.